Welcome to Heartspeak Podcast, episode 39, Patient-Centered Care. I've just recently started a new course with my Japanese friends, an online course on holistic health, thoroughly enjoying it. As much as I enjoy the panels I'm invited to sit on and speak on about holistic care with holistic practitioners all over Japan. It allows me to both share my wisdom and also stretch me as I listen to their brilliance and their ideas. And it's made me think about what got me involved with holistic health all those years ago. In fact, most of my life. And I'd like to share this with you. Some of you have heard my ideas before about what I believe illness is about, what health is about, but I want to give you a little bit of my own background and why I feel holistic health is so important, but perhaps it's lost its way and would be better termed patient-centered care. So what is holistic medicine? Holistic medicine is or has always been seen as the integration of mind, body, spirit, bringing together all aspects of a human being in their health care, in taking care of themselves. And I think even that definition is a challenge, because what is the body? What is the mind? What is the spirit? And I believe the body, as you've heard me speak about, has its own wisdom. And at the end of this podcast, I will share a little meditation for you to listen to the wisdom of your body. I believe that every cell of your body wants to speak with you. Every cell of your body loves you greatly, wants to help you to achieve your soul's destiny. Now you might say, well, who cares if I'm feeling ill? But sometimes we need to feel ill in order to make changes. And I'll talk a little bit more about that. What is the mind? Well, we could call it consciousness, but that's a difficult word, as I've described previously, because consciousness can be found in the body, it can be found in the mind, it can be found in the spirit. Consciousness is that which is known. And so what is conscious may be your emotional state, but it may also be what you're feeling in your body. It may also be how you're being inspired with new ideas. So let's just stay simple, hopefully, and talk about the mind as being our beliefs, our emotions, our thoughts, our feelings, but all of them we could assess as coming from different aspects of our brain. I've got to say it that way. The limbic system, the neocortex, the frontal lobes. We could perhaps say, that's where that's stored. That isn't totally true, because many a time we store our beliefs in our body. We could say in our DNA. If you follow the work of Bruce Lipton, we know that the receptor sites on our cell membrane has a great deal to do with what we believe. He believes our receptor sites are, in fact, a record of our perceptions of our reality, so that when you change your perceptions, you change your beliefs, your receptor sites also change. And why is that important? He believes that your receptor site is like a lock, and if a key comes along and fits into that lock, there is a cascade of energy process that will then unsheath your DNA to express a certain part of what your DNA carries. I hope that's saying it in a simple way. But what he's saying is, if you don't have a receptor site to a certain belief or a certain virus or a certain problem, then you won't see that problem manifest in your body. Just to say it in a simple way, I hope that if you believe that when someone sneezes, oh, that's it, I'm going to catch a cold tomorrow, you will catch a cold tomorrow, because you have the lock in your receptor site, as one of your receptor sites on your cell membrane, that says, when people sneeze, I catch a cold. So whether it's the virus fitting in there or just even the belief, the following morning you wake up and you're full of cold. And it's so interesting, and it always has been interesting to me, when people have talked about 9 out of 10 people are going to get sick, or 99 out of 100 are going to get sick. I'm not interested in that. I'm interested in that one person who doesn't get sick. What makes them different? And I did a lot of study of looking at the belief systems of individuals and how that affected them. And if you didn't carry a belief about being stupid or not pretty or being fat, then you had a very different way of dealing with your body, dealing with your mind. So our perceptions really do drive us. And Deepak Chopra tells that great story at the beginning of one of his books about a woman who had cancer, and she was cured by apparent causes from everything that she did, and I can't quite remember the different things she did, and she had no symptoms. And he saw her several months on, and he said, "Isn't that wonderful? You have no symptoms." And she said, "Yes, it may come back." And that belief in "yes, but it may come back" meant that a few months later it came back. So when we carry those beliefs, they are the ones that will influence our wellness or our state of health as much as they are as how we feel in our body. I remember a great story of a man who came in to the hospital. He'd walked all maybe 3 or 4 days out of the bush, who's where he lived, and he had a pain in his arm. And the doctor x-rayed him and said, "Oh my goodness, this is metastatic cancer. You have cancer everywhere." Now this man had never heard of the word cancer, so he went, "That's nice." And the doctor said, "No, you've got to stay in. We're going to treat you for cancer." And the man said, "Well, thanks very much, but I've got to go back to my herd. I've got to go back to my farm." And the man walked off. And the doctor said, "Well, that's the last we'll see of him. He'll die there." And then about 10 years later, he came back with another problem. And they scanned him, and there was no sign of cancer. And they said, "How did that happen?" And they said, "We told you had cancer." And he said, "Yes, that was very nice. I heard you say that." But because he didn't have a belief about that word cancer, the cancer had resolved itself. So our beliefs are so strongly imprinting how we see ourselves, not just in terms of health, but in the realities we create for ourselves. Now, please, I am not saying you caused your cancer, not from that place. I am saying is the beliefs will show themselves through our body, allowing us to change them. It's very different. Am I saying you caused the illness? No. Am I saying that your soul is using illness as a messenger? Yes. You're saying, "Well, it sounds the same thing." It's not. I'm saying is whatever the illness is, it's not by chance that it appears in that particular place, or not by chance that it appears in a certain way. What am I saying? So if you have inflammation, what's inflammation? It's red. Where are you feeling red? Where are you feeling that you feel angry? Where do you feel frustrated? So inflammation, tightness, tight muscles, all to do with that. Where am I needing to change what I'm doing? In the same way, cancer, what is that? It's a rebel cell. These cells won't conform. So here's the rebel in you emerging. Where do you need to rebel? Where do you need to tell people, "No more"? So the illness always gives us a face or something that we can work with. And that to me is, what is the belief you're carrying? And what is the emotion that needs to be expressed? Seeing each of the emotions as a very valuable way of expressing how we feel and moving. So when you have tears, it washes away the old patterns. When we feel angry, it's the energy of movement. When we feel joy, it's about filling ourselves with that newness. So each emotion has a quality, and each of those emotions need to be appropriately expressed for us to feel well. I may well have mentioned in a previous podcast about it's not the emotion that causes the illness, it's the inappropriate use or suppression of that emotion. In other words, when you laugh when you should cry, or when you feel angry instead of feeling frightened. when we express the appropriate motion at the appropriate time, we actually get a positive immune response. So our mind is made up of this myriad of beliefs and emotions. The beliefs often pass down through many generations. And we call that our family history, or we call them family antidotes, or different ways in which our family may have these little mottos. In other words, we may say, my father said to me, money doesn't grow on trees, or the devil makes work for idle hands, or do what you need to do before you will do what you want to do. If a job's well done, do it yourself. Money, it should be saved, not spent. Keep it for a rainy day. What are your mottos? That's what's important, because they're the beliefs by which you are living your life. And they're often mottos about work and money and relationships and sex and pregnancy. They're the common work. They're the things that we put into our lives. So what are the mottos? Because these are the beliefs that are creating the receptor sites. They're creating the locks waiting for the key to arrive. So now if I just move on to spirit, well, what is spirit? Spirit is more difficult to define, because in many ways people define spirit as a belief. Are you spiritual? I worked with that in the previous podcast. Or I'm a very religious person. I pray a lot. I meditate a lot. So what's the belief behind your spirit? Oh, I believe that. So prayers, religion often, beliefs, they're all part of the mind. They're not part of spirit. What does it mean to be in spirit? It means being inspired. So true spirit, when we talk about body, mind, spirit, is the inspiration that comes from a divine source, or comes out of the blue. And they're often the reason why we talk about someone having a spontaneous recovery, a spontaneous renewal of their whole beingness. And when we see that, it's often because something out of the blue has happened. They have this miracle that we say, wow, spirit must have touched them. I remember meeting a girl who was very seriously ill as a child with an illness, cystic fibrosis, that usually in the age when I was working as a young doctor would have killed that girl. She would have died of that in her late teens. But here she was in her early 40s, and her father said, well, here you are, this is my daughter. She has or had cystic fibrosis. And I said, how is she still alive? And he looked at me and he said, well, we went to Lourdes, which is the wonderful Catholic site in the south of France. And he said, she was cured. And his belief in the power of prayer, the power to cure, had allowed spirit to move through her, which truly had cured her. So spirit, in that essence, is coming from a place which is beyond the mind. And I think that's important for us to understand. So then you might say, well, is that patient-centered care? And I'd say, yes, it is. Because we're looking at the whole person, the body with its wisdom, the mind with its wisdom, and the spirit with its wisdom, and its love. But the soul holds it all together. And that's where the love for me comes in. Each of those aspects, the body, mind, spirit, all work or funnel themselves through the soul. And what is the soul? The soul is the unique aspect of you. The soul carries your blueprint for your journey this life. And it's carrying it and saying, I will use anything in my power to make sure you fulfill your destiny this life. I don't care if that's illness or your house burning down or a divorce or loss of a job, but I will get your attention. And commonly when we get sick, we do get the attention, or our soul is heard. So our soul speaks to us through our intuition, different messages of our intuition, but it will also use the body to get the point across. And as I have described previously, the way I like to see it is that healing equals wholeness. So if I'm a healer, I am helping people to become whole. And as a healer, it is also within me to do my own work, because the more whole I am, the more wholeness I can entrain other people to be. It's like being a tuning fork. So the more wholeness that I embody, the more wholeness I can give to others. And that's why I see wholeness as the soul in the center of a flower with lots of petals. And our journey is to open each of those petals. I've mentioned this before in other podcasts. And that sometimes when we get sick, our soul is saying, okay, you've spent enough time in one of those petals, I'm moving you over to another petal, because it's time for us to experience ourselves in a different way. So that's how I see holistic health. Holistic health, patient-centered care, soul-centered care are all about embracing, integrating body, mind, spirit. Hence why we have this word integrative health, a new word perhaps compared with when we used to use holistic health as a way of defining this very whole sense of being. And holistic health is not, I want to say, confined to complementary alternative medicine. Every doctor, every health professional, whatever your practice, should be practicing patient-centered care, holistic health care. It's not about the type of therapy. It's the way you look at your client. It's the way you look at your patient. So that's how I define this. So let me just go back in my own history. I was brought up amongst healers, homeopaths, mediums, and everything weird and wonderful that allowed me to see this level of holistic care that wasn't just about fixing the problem, giving a tablet. And I was allowed to see this through one of my mother's friends, name is Jean, and Jean really allowed me to understand that when we listen to spirit, when we listen to our soul, healing can come without us needing to get sick. Now, did this mean that my parents didn't have a belief in orthodox medicine? Absolutely not. I had my tonsils and adenoids taken out. We would go to our doctor. But everything that we did was in this environment of not being a problem, but how do we bring health, or how do we bring me back to healthiness? Not that there's something wrong with me, but recognizing illness as a signal to give me more rest, perhaps. Those of you who are as old as I am, maybe you can remember having measles, mumps, chickenpox. It was a time of rest. It was a time of comfort. It was a time of being special. I could have the special attention of my mother. Maybe it was a time of chicken soup. Maybe it was a time of special attention. I can remember new paints and paper to draw on, maybe a new book to read. And when I've asked people what was different about when you got sick from when you weren't sick, I would say 80% of us all see illness in our childhood as a memory where we were more comforted, we were taken care of in a very special way. Now I say 80% because I bet there's 20% out there who say, that wasn't how I was treated. I was told, get over it, get back to school, or mind over matter. And perhaps you still do that to yourself. You see yourself ill and you just keep going. And I remember people telling me that their mother had been sick. And they said, well, if my mother's that sick, I can't be sick because she's really ill and my illness is nothing. So I really would ask you to look at what are your messages, or what are the messages you received when you were a child about being ill? Was it okay? Was it a time of comfort? Or has it been something that you've looked at and said, people should just, move on and get beyond it? It's an interesting question. So I go back to my mother's friend, Jean, and Jean did develop breast cancer. And I was a teenager then. And every week we would visit Jean, and here she would be not only looking at orthodox medicine, but she would also be looking at what nature or natural cures could she use to cure her cancer. And so one day we would arrive and there are grapes hanging everywhere because she's on the grape diet. And the next minute she's drinking her urine because she's on the urine diet. And the next minute she'd have green leafy vegetables because that was the diet she was on. And I loved her for it. She always was looking at what else could I do to be healthy. And the breast lump did continue to grow. And she said, well, okay, I'm going to try one more thing. I'm going to go to have psychic surgery. It was actually in the Philippines. And she saw her consultant and he said, okay, if you come home and the breast cancer's still there, the tumor's still there, I'm going to remove it. But you can have this week away in the Philippines and I'll see you afterwards. So she went off to the Philippines. She had the psychic surgery. She came back for her appointment. And the surgeon looked at her and said, the lump is gone. And he had the honor and the dignity to say, I think we've had divine help here. And it was many years after that, I will say many happy, healthy years afterwards, that the cancer did come back. And she did end up being in the homeopathic hospital in London, and she was dying. And she never lost her sense of humor. She never lost her sense of exploration. So I was in the ward with her and she was having difficulty breathing. I was helping her with her oxygen mask. And she said, come closer, because she was really having difficulty speaking. And she said, you know, Chris, as they are lowering my coffin into the ground, I'm going to push open the lid and say, I've got another idea. And that was Jean. She never, ever gave up. And that's what she instilled in me, bless her. Never, ever say there's nothing more we can do for someone. There's always something we can do. And you're not always looking for cure. Jean wasn't looking for cure. She was looking to find life within herself every day. She was looking for adventure every day of her life. I hope you have that same part of you. And remember, if you are a health carer, a health practitioner, most of our patients are not looking for us to fix their problems. You might think, no, that's why I went into medicine. That's why I'm a nurse. That's why I'm a practitioner. No, ask them what they need. We often assume we know when we don't. So many years on, I went into general practice, and I was so excited to be on the original committee of the British Holistic Medical Association, because I had spent time with the wonderful doctors of the American Holistic Medical Association, and we'd been inspired to set up our own system, our own organization. And I thought, here we are doing what I believed we could do, is look at the whole person, and we were all very excited about it. But over the years, I watched as mind, body, spirit became separated. And if you had a problem with your body, you would go to maybe a physical therapist, a masseur, someone, an aromatherapist, someone who would work on your body. If you had a problem with the mind, you'd be sent to a psychotherapist, or you'd be sent to someone now working in counseling. Or if you had a problem with your spirit, you were sent to learn yoga or meditation. Now you might say, well, aren't all those things wonderful? But what happened is body, mind, spirit became separated. It was a reductionist way of looking at the body yet again, at looking at health yet again. Oh, go and see this person, go and see this person. And what I saw is that even complementary practitioners, alternative practitioners, were dividing the body up. You need to take this, you need to take that. But they almost came to a point where if you're having my therapy, you mustn't have this other therapy. And so commonly it was again back to, how do we fix this person? Come and have my treatment. Come and be dependent on me. You can have my treatment. I'll make you better. But nothing about the patient. It wasn't about their life. It wasn't asking that question I always ask, what was going on in your life when you got sick? It was, come and have a treatment. I'm going to not ask anything deeper about you. I'm not going to inspire you to find your own inner healer. I'm the therapist. I'm the healer. And so over time, I left that work. I left it both in terms of leaving general practice and in leaving my homeopathic practice, because I saw we just had professional patients who went from one person to another without anybody asking them to be accountable for their own healing. That is not about saying, go away, don't come to me, but much more about, wow, how do we work together to create your wholeness? How can I serve you? How can I support you in your healing journey, your true healing journey? There was a study done many years ago when they found out that maybe 50% of Americans were taking some form of alternative medicine. They called it alternative. But when they looked at it, it wasn't alternative medicine. It was all vitamins, and minerals. They were dosing themselves up, often driven by, again, a different type of drug company, to have something that they could take, pay money for, to prevent illness. Because heaven forbid that I might have to look at myself. Heaven forbid I might have to do something on my own. Heaven forbid it may be something to do with my life, and therefore I'll have to change. This is not truly holistic medicine. Holistic medicine says, hey, I will create a sacred space for your healing journey to occur because I'm doing my own work. Holistic medicine is hard. Patient-centered care is hard. And I use it patient-centered because I've seen some patients who are bombarded with several different practitioners, all trying to work on them. But it's almost like the practitioners are so invested in what they're doing, they forget the patient in the middle. It's as if the patient walks out from between their legs because nobody asks them what they need. Am I being harsh? No, I'm being realistic. I've been in this work for 50 years. I love medicine. I love healthcare. I love holistic care. But why have we forgotten that the person we're trying to help is the patient, and that what's trying to help the patient is their soul? Why are we so invested in our own journeys, or maybe in the financial needs of myself, or maybe the hospital or the clinic, where we forget why the patient is there in the first place? I want to get paid because I keep my patient well, not because they come to me because they're sick. So true holistic care is, how do we empower our clients, our patients? How do we as a patient or as a client feel empowered? We find the right practitioners, the practitioners who truly want to help us. And we demand that, whether it's an orthodox practitioner, a doctor, or whether we're going to a complementary practitioner. Are you serving me, or are you serving yourself? And to be able to do that, we need to come home to our bodies, which is why I'm going to complete this podcast with a meditation. And obviously, I suggest you don't do this as you're driving. So you listen to this later on if you're at work or driving or doing anything else that needs your full attention. Because what I find is that when we don't honor the patient, we're not asking them to be in their body. They're out in their head. They're worrying about something. One of the quickest ways of helping us to be here is to come into our body. So for the next few minutes, I'm going to invite you into your body. And you may find there are times where your mind wanders. If your mind wanders, just gently bring it back. Are you ready? So if you're in an appropriate place, please close your eyes. Take a few nice breaths, short breath in on the count of 3, long breath out on the count of 6. Settle into your body. If your mind wanders, just gently bring it back to your breathing. Take your awareness to your right foot. Can you feel and sense your right big toe? Can you become aware of the nail on your big toe? As if you were touching it. Can you feel it? You don't touch it, just feel it with your awareness. Now move down your toes on your right foot. Second toe. Third toe. Fourth toe. Little toe. Are you aware of all your toes on your right foot? Move your awareness to your left heel. Can you feel your left heel? Are you aware of your left heel and the ankle around the left heel? If your mind wanders, just gently bring it back, just with your breath. Move to your right knee. Can you feel every aspect of your right knee? If there's any pain in any of the areas we go to, breathe compassion into that area. Just breathe awareness and compassion. I see you. I feel your pain. I know you're there. I'm paying attention. Let's move up to the left thigh. Big muscles there. They'll hold you up when you're standing, when you're walking. Just smile and thank your left thigh for all it does for you. And then move up to your spine, from the very base of your spine. Can you walk each spine all the way to the top of your head? Excuse me, to the bottom of your head, to your skull. If you feel or aware of any pain, just loving attention, please. Loving attention. I see you, I feel you, I know you're there. And to your breathing. Just breathe in and out, allowing the whole rib cage to move. Can you feel every rib moving, front, back, side to side, as you breathe? If your mind wanders, just bring it back with loving attention. Go to the left palm. Can you become aware of the energy of your left palm? Smile at it. Feel its energy. It's a very powerful place. And your right shoulder. If you feel tension or pain in any of your areas, especially your shoulders, loving attention. Breathe into the area. Now your tongue, can you feel it just resting gently in your mouth? And then finally the top of your head, your scalp, even your ears, can you feel them? And now just settle yourself once again down to your feet, both of them, wherever they are. Bringing yourself right down, rooting them into Mother Earth. And in your own time to open your eyes. I hope you found that valuable, useful. Sometimes we have awareness. I don't spend much time in my body. I just picked a few of the different areas of your body that we could go to today. But I truly ask you to take this as a practice for you. You can do it in bed, you can do it sitting on a train, you can do it at work. Just take yourself through your whole body from your feet upwards and pay attention to the areas that perhaps have got pain or stiffness, loving attention. But the more you're in your body, the more you'll feel strong about making sure that your care, whether you're ill or whether you're well, is patient-centered, heart-centered, soul-centered. And allow your body to demand that care from anybody who's around you who calls themselves a healthcare professional. And so with that, I send you much love and blessings until next time.
Thanks for listening to the Heart Speak podcast with Dr. Christine Page. Remember to check out other episodes in the podcast archive section on www.christinepage.com. And do share with friends, family, and colleagues. Join us next time for another edition of Heart Speak.